I have learned a lot in Issues in Aging that will be helpful with my professional career as well as my personal life. An elder is defined as someone who is 65 years or older. The elder population is increasing due to the fact that the baby boomers are reaching an elder age, as well as the fact that life expectancy has increased from 77.6 years in 2003 to 78.7 years in 2010. This is a large increase for a short period of time. This is most likely due to the fact that we have developed better technology and better medications. We also have a diverse elderly population. Statistics show that by 2030, 1 in 4 elders will be a minority. It is important for healthcare workers to understand that many of their patients will be from a different culture and will have different beliefs. The Hmong population is a great example of a culture who has different beliefs than our own. I found it very interesting that they believe that it is disrespectful to look someone in the eye, whereas in our culture, it is perfectly accepted and looked at as a sign of respect when looking someone in the eye during a conversation. There are a variety of body changes that many elders go through as well. It is a normal part of aging to lose thickness in skin as well as losing a large amount of hair. Musculoskeletal changes happen as well, and the spinal column can begin to shrink due to the fact that the discs begin to collapse. There are several other changes as well, including changes that happen in the brain that can affect our nervous system. This includes the fact that the gray matter in the brain begins to thin as well as atrophy. The sensory system also changes, which can be dangerous because many people can lose their sense of balance, and in elders it can cause many falls. Another topic that I thought was important to talk about was changes in sexuality. There are many misconceptions that the elders are no longer interested in this type of activity. The truth is, the sexuality can be a very difficult or uncomfortable topic to discuss with the elder patients, but is an important key component to adult life. Elders must feel comfortable to talk to their healthcare providers about the negative effects they may be experiencing due to medications or other physical body changes. So it's important for all healthcare members to be open-minded and allow these patients to have the time to talk to their healthcare providers and receive the help they need. An increase in the elderly population has led to an increased need for long-term care and other medical services. There are multiple different types of services that are offered to the elderly population. There are different types of long-term care facilities, including CBRFs, which is a community-based residential facility that helps with 8 activities of daily living and can offer up to 3 hours of actual skilled nursing care to a patient per week. An RCAC is a residential care apartment complex. They allow 28 hours of care per resident, but this includes housekeeping, transportation, medication management, but they also have emergency assistance 24 hours a day. These people are usually more independent than people who live in a community-based residential facility. The last type of long-term care facility is a skilled nursing facility, which is much more intensive care, which is what is thought of usually when people think of a nursing home. Another option is in-home care, which is ideal for many people who just need help with a few different activities throughout the day. People are more comfortable in their own homes, so if possible, many prefer this system of care. Alzheimer's is another big topic that we discuss throughout the healthcare aging class. Alzheimer's has become a much more prevalent disease in our population. Over 5 million Americans are living with Alzheimer's, which is a very large amount of people. This brings several implications for health professions and nursing homes. It is important for health professionals to understand how to communicate with someone that has Alzheimer's. We have learned recently that yelling at someone will only make the matters worse. We also watched a great video about how the environment in a nursing home can affect someone with Alzheimer's. It was very interesting to learn that different colors can help people understand where they are supposed to go or where they are supposed to avoid. I think this is an important application for nursing home and CNA and other public professionals to understand in order to make someone with Alzheimer's life simpler. I learned a lot about health promotion because that was my group's topic. We have learned the importance of staying active is still important for old age. The biggest hazard of immobility is death. I learned this in one of the last classes, and I believe it is one of the most important things for people to understand. We discussed that when many older people break a hip, they are bedridden and never end up getting back up again. It is important to maintain good health and physical fitness in order to recover quicker or reduce the chance of falls. We have also found that living a healthier lifestyle will be a better solution in the long run because prevention is much cheaper than emergency care. There are many different benefits that come with healthy living lifestyles. Many of these I learned from the Ministry of Health Clinics. They say that participating in physical activity can help reduce the amount of falls that a person can have a year. It also prevents or delays the onset of many different types of diseases. General benefits that many other people besides the elderly can get include managing stress or depression, improving mood, and also for elderly, it is a nice social aspect for people to participate in exercise and they can stay out of isolation this way. The last topic I wanted to discuss is the effect of medications. Many people don't understand that there are multiple different reasons that can keep a person from taking their medications. It is important to consider the effects that medications can have on the elderly population. Many people are more sensitive to a drug, so there can be a stronger drug effect when they take the drug. Elderly often have a declining renal function, declining liver metabolism, and a decline in lean body mass, which can lead to drugs staying in the body longer, which can cause a stronger adverse effect. Many elderly are on at least 6 to 8 medications in a nursing home or in general elderly life. There can be many different drug interactions that may be overlooked, so it's important to compare the different side effects of drugs to make sure that one does not worsen the other or compete with another, which could cause other issues. Adherence to medication is also a big problem for the elderly. This could be due to a bunch of different reasons. Cost seems to be the number one reason that the elderly does not adhere to their medications. This is a big issue that has been worked on and needs to continue to be worked through. Other issues that would lead to non-adherence to drugs would be a social or economic issue, a healthcare related issue, a patient related issue, or some kind of cultural belief. Overall, I'm very glad that I had the time to learn about the issues that the aging population faces because we will all have loved ones who undergo different types of aging processes, so it's important to understand what they will be going through. As well as many of us will be working with a population that includes many elders, whether it's physical therapy, occupational therapy, diagnostics, or healthcare administration.